I'm a radiation oncologist. What that means is I'm a cancer physician who actually treats cancer with radiation, meaning utilizing special equipment or special types of surgery in order to treat our patients. What we have is a linear accelerator. What we do is convert electricity into radiation. It's a very easy and simplistic technique, but it's done by this big equipment. The large equipment actually allows us to pinpoint our radiation to such a fine tool as a very small beam. I'm sure many people have heard of bloodless surgery, so it's a very similar technique to that, in the fact that I can treat any place in the body without having to open up, without having to expose that patient or put them in the hospital for treatment. It's a large machine that makes a lot of movements, and realize that it rotates around the individual 360 degrees, so in a complete circle. As it's doing that, it's gently giving radiation at each and every degree of movement as it moves around that circle. So when they see the machine is very far from them. It's not like they're in a CAT scanner or an MRI. So it's not closed in. There's nothing touching them necessarily. There's nothing that's actually against their skin. There's not that claustrophobic type of effect that they may see before or have had experienced before with an MRI. You can't feel radiation. Radiation isn't something that you can sense or touch or smell. It's not painful whatsoever. So my patients are brought in, they're treated, and they have, their experience ends up being wonderful because of the staff and actually the environment that's set up for them. So do I only treat cancer? Yes, mostly. There are some benign diseases I treat. A great deal of our HIV patients, in treating them for like parotid hypertrophy. They'll see a lot of widening of their face because of enlargement of the parotid gland, which I'm going to move my hands, but set right here on the sides of their face. And they'll see widening of the face at that point. It is mostly a cosmetic issue. It also can be somewhat of an issue as far as eating and swallowing, because they'll bite the inside of their cheek mostly. We can treat them over about a 1.5 week period of time and give them very low doses of radiation, be able to shrink that down and allow them to almost get back to normal.